Hello, and welcome to the Simply Business Interview Podcast, a podcast created by business owners for business owners. I am your host, John Jennings. And I believe that most business owners are working way too hard for much too little. And one of our issues is that we overcomplexify things. I believe the answers are almost always within us or within our reach. I like to say that I'm a simple man with simple ideas. So welcome to Simply Business. All right, so today we are joined by Kirstie Matzek, who is the CEO of Shawnee Christian Healthcare. They're a federally qualified health center headquartered here in Louisville, Kentucky, and very familiar with these folks and what they do. Love what they do. Love bringing these folks on the show because there's so much what they do is about their mission and their purpose, and it just resonates with my listeners. So Kirstie, welcome. Why don't you start by just tell us a little bit about yourself and about your role there at Shawnee Christian.
Yes, so I have been the CEO here at Shawnee for a year now. I know that we've talked a little bit, and I said even it feels like maybe 5 years, but it's only been a year in this role. I came from Baptist Health and was the director of operations at that organization, and then moved to the CEO role. So a little bit about me: I've been in healthcare since I was 18, and I'll say I have probably started from ground up. I started as a receptionist and kind of worked my way up through pediatrics, and then kind of worked my way into a leadership role there, and then decided to go back to, well, not back to school, but kind of finish in a different route than what I potentially started doing, and then landed here. So that's where I am now.
So that's a big jump from a director to a CEO. Even though I know it's a director in a huge organization, a CEO in still a large organization, but not as large. What kind of inspired you, motivated you to want to make that kind of leap? That's a courageous leap.
Yeah, it definitely is. So actually the board chair for our organization knew me from Norton Healthcare. So I had previously worked at Norton before being at Baptist, and knew that I had a passion for the community and knew that I had a passion for those that were underserved. I'm also a product of West Louisville. And so that was very important to me as well, because I know what that feels like to be judged by your zip code, or not having healthcare opportunities because of your zip code, or things like that. And so having that opportunity to be able to be a part of making the change was something that is a passion of mine. And so she tapped me on the shoulder and said, "Hey, there's this opportunity. Would you be willing to at least talk about it?" initially? And so that's what we did. I know it was several months, because those were things that I needed to make sure that I could handle, but also that I was ready for. And so decided to take that leap, and it has been a ride ever since May of last year.
Okay, so what was the biggest surprise stepping into that? Now you're the top of the org chart. I know you have a board, but still you're day to day the person at the top of the org chart. So what was the biggest mindset change that went on with you?
I think the biggest mindset change for me was the fact when people tell you, or you've heard people say that it's lonely at the top. I think that's a legit statement. Before I had this role, I thought, okay, yes, I can understand what that feels like in a sense, but I'm not going to say I didn't think it was 100% true, but you still think, you have some level of, support or something. But when you get into this role, it is definitely reality. You are alone. It's lonely at the top, especially from transitioning from a large healthcare organization to an FQHC. I think that was a mindset change for me as well, because I had to learn how to navigate the system a little bit differently. My pockets were a little bit smaller from where I've come from. And then also having a support system of, at larger organizations, there are people that do those things for you. When you're at the top of the org chart, all the responsibility falls on you. You don't have all of those people to help you and assist. And so you have to get creative in how you navigate. So I think that was the biggest change for me. Mindset change was changing how I navigate now, because it's kind of like this is treating this as if this is my home. This is my business. No one else is going to run it or do it for me but me.
Right.
So I think that was the biggest mindset change for me.
Very good. Yeah, and it's so true. That's
Yeah.
the lonely at the top is not, it's not a metaphor. It's
No.
absolutely 100%.
Absolutely true.
Uh,
110% true. And I've always been a go-getter, like to try to navigate even in larger healthcare systems, but there were still always people that could point you in the right direction.
yeah.
But then when you come from a healthcare organization to an FQHC, you don't have you have network of people, you have CEOs and things like that, but trying to figure out who to reach out to and how to get connected with those folks without seeming very creepy of like randomly showing up or randomly calling them, not having that network of individuals, I will say has definitely was a challenge until, trying to figure out how to navigate and get in touch with those individuals.
Yeah. So what do you do to not feel so lonely at the top? What are some of your strategies?
Yeah. So one of the things that I can say is being a go-getter, getting myself involved and finding the organizations that help you. For instance, our primary care association, NAC, being in tune with them or trying to connect with them and being in their membership, getting information from them. One of the biggest things I think was probably the most important thing that I could have ever done as a new CEO was do the CEO Institute with NAC. I was fresh, probably about a good solid 3 months in, and that opportunity became available. When I saw an email come through and I jumped on it and applied and was like, here is where I am. This is the state that I'm in. I am a new CEO. I have zero clue what's going on. Please, can someone, please help, or I'm looking forward to this opportunity. Being involved in that institute gave me the ability to be around other CEOs.
Yeah.
There were seasoned CEOs that were there, people who had been CEOs for 15, 20 years. There were CEOs just like me who were a week in or 2 weeks in or a month in. And being in the same room with them, being able to collaborate, being able to also realize that you're not alone. I think that's the biggest thing is when you're in this seat by yourself, you have this thought of, no one else is going through this. I mean, there are things that I could probably tell people that would blow their mind. And then when you're in a setting with other people that are like you or in the position that you're in, they are like, you are not alone because I've experienced that. So being able to tap into those individuals, that is probably the best thing that I could have ever done was to be a self-starter and figure out what company can I reach out to? Who can I be a part of so I can have a network of CEOs from FQHCs so I can depend on these individuals because you kind of feel like you're on an island by yourself.
Yeah. That kind of mastermind concept goes a long way, and
Absolutely.
very much a valuable tool. So, can you share maybe one of the biggest challenges you faced and kind of how you overcome it? That's kind of the theme of my book and theme of my
Gotcha.
practice, my coaching practice.
Mhm.
It's about overcoming things. So,
Yeah. Yeah. I think the biggest challenge for me was coming into this seat after, I think anytime for anybody in leadership, coming in after another CEO. Because and especially if the CEO has been there for a period of time, and you have staff that are attached to those individuals. And so as we all know, most times if that's the case, staff have a really hard time of connecting with you or really not wanting to because things didn't go the way that they wanted it to go, and things like that. So that has been the most challenging piece for me is changing the culture of the center has been the most challenging piece, and doing it in a way that is still respectful to people, and to the employees, and then also kind of changing the trajectory of the center, and no
yeah,
longer is it kind of what works just for the center and the people that work in it, but getting back to the mindset of we're here for patients and we need to do what's right for patients, not necessarily what may be right for 50 other individuals.
right.
So I think that has definitely been the most challenging piece for me. And I think I mean, I'm not going to sit here and say that it was super easy, or that it wasn't difficult. Or I'm not going to sit here and say that there weren't times that I thought this is not for me, because I've probably had more of those thoughts than not, of like, I don't think I made the right move. But I always found, there were a time when I was on the floor working with patients, and I think that was the time of having patients tell me how thankful they were that we're here.
Yeah.
And it wasn't just a kind of like, by the way, hey, thanks for being here. It was a really, compassionate, sincere thank you. And so for me, knowing that patients realized and started to see the differences, because they would start making comments about how the center has changed, or how it's been more, whether it's more professional or pleasant or inviting, those things kind of kept me going, of like, I know it's tough. And I know that people are having issues with change. As we all know, people have problems with change. And
Yeah.
so that has been, I think, probably the most challenging, is changing the culture.
Yeah. Well, your place, I know, was going through a lot of changes before you got there. The
Yeah.
pharmacy was coming in, and
Right.
the dental office moved. You did you were doing all kinds of physical moves, which that
Right.
creates stress on people.
Yeah.
So what was changing culture is one of the absolute hardest things for a leader to do. So
Absolutely.
what what are some of the things you did to
Mhm.
change the culture? Because I know if healthcare has turnover problems as it
Oh,
is,
yeah.
and then FQs have even greater problems because
Mhm.
you're in many cases not paying at the same level, and you're in not the best parts of town, and all that kind of, you
Right.
got all those things working against you.
Mhm.
So how did you go about changing the culture?
Yeah. So I think the biggest thing for me was consistency, being a woman of my word, and being consistent in my reasonings for doing things, and
Yeah.
my consistent, my every time I would say, hey, let's talk about this, or let's think about that, it was always with the patient in mind. It was never my own personal agenda. You can ask any staff member, who's left, my message was consistent about, what about the patients. The other biggest thing I would think is pulling in, those staff members, because we'll be honest, not all staff members are going to be on board with you. That's just point blank. That's inevitable. You have to accept it and deal with it. But you still have to keep those individuals in mind. But it does reach a point at in some time where you have to realize that those people either have to kind of get on board, or you have to leave them behind.
Yeah.
And so that's the difficult piece with that for me, was realizing that, okay, I've met the point with this individual. I'm going to have to leave them behind and keep moving the train forward. So I think the biggest thing was consistency, and then also getting buy-in from the staff and giving them the why, because I'm never one that's going to come in and say, well, this is just how it is and you have to do
Right.
it. My why was always, again, consistent with patients. What are we doing for the patients? This is right for the patients because,
Right.
and then, being able to show them data. That was the biggest thing as well, because they can hear my mouth all day and hear me
Yeah.
say things all day long, but without showing them the truth, or without showing them the data, um, that was, I think, beneficial as well. And most times in leadership, people are like, oh, we can't tell the staff everything, or let's not. I have found that I'm very transparent as much as I can be. I'm not going to tell everything, but
Right.
I think being transparent with the staff and telling them, this is where we are today, and this is why we are where we are. So in order to get here, we need to do these steps. And so I think that has been successful. I say for me, and I think success looks different for everybody. The fact that, maybe I have not started, the people that have started with me, I probably have maybe a few of those individuals left. And that may not always be a bad thing. I always say that sometimes not all turnover is bad. I say that there was some healthy turnover for us that needed to happen in order for us to move forward. So it goes back
Sure.
to me saying, that's the moment when I realized that I'm going to have to make some tough decisions and leave some folks behind that are not on board with the train that,
Yeah.
or the direction that we're moving in. So,
Yeah.
yeah.
Hey, there was a ton of great stuff you had in there. Breaking down a couple of them. What One was that whole part about just leading from your values, from your why, from your purpose. You know,
Absolutely.
it's a lot easier to give somebody bad news, or it's a lot easier to make a tough decision when you look at it through the lens of your values and your purpose, and it
Right.
becomes crystal clear. And
Mhm.
most of the hard decisions do become crystal clear if we're honest with ourselves.
Right.
So that's really a powerful lesson for folks. And the other, and I think you and I talked about Trust Edge material probably about a year ago, shortly after you came on board. Uh, but that 8 pillars of trust that it takes
Right.
to build a foundation. The first
Mhm.
one is clarity, and the last one is consistency. I don't know if you remember
Right.
that. You kind of hinted at clarity when you said, you're transparent, just tell it like it is and explain
Absolutely.
it. And then consistency.
Mhm.
Um, that's one of the best ways of building trust. People don't like walking into their leader's office not knowing which side of the fence they're going to
Right.
be on in a decision.
Mhm.
It's a lot easier and a lot more. It leads to a better culture when they know where their leader stands, and there's
Mhm.
no real surprises.
Yeah, no, absolutely. And my staff will tell you, they're like, we know exactly where we stand with Dr. K. She will tell us, they know I'm very respectful, and I'm
Yeah.
very polite and professional about it, but they understand because I always say there leaves no room for guessing. If I
Yeah.
tell you exactly what I'm thinking or exactly what needs to occur without giving you any kind of, wiggle room, you can never come back and say, she didn't say this or she didn't clarify this. I am very consistent in being very direct in my communication. So no one can deviate left and say, well, I took it this way. Well, I said exactly, I said it exactly, and I said it multiple times
Yeah.
because I feel like consistency, and I always have an open door policy as well. And I tell them just because I'm the CEO doesn't mean that you can't come to me and ask me a question or you can't question me. Well, you have to question me correctly, of course, or professionally. But you can do that. It's fair game. Just because I'm the CEO, if you have a question, I'd rather you come in and let's talk about it before you create some assumption or you create your own view on it or whatever that might be. Just come to me and let's have the discussion. Let's talk about it. So I try to provide that opportunity as well. The other things that I've done in regard to changing the culture with the open door policy is, giving the space when there is change. I give the staff the space to be able to reflect on, what are your issues, what are your concerns, what are you not happy about. I give them the space to do that as well. Like, let's talk about it. Like, I know these are difficult conversations and I know that you're not 100% happy with the decision, but tell me why you're not. Let's talk about it.
Very good. So tell me, I'm just curious because I you jumped you stay within healthcare, but you jumped into a very different type of healthcare and very different regulations and different oversight and all kind of stuff. How did you make that leap? What was your approach to learning? Because I hear a lot of people go, well, I have to do, I've always done X, so I have to stay in X. You're still within healthcare, but you're in a very different segment of healthcare.
Oh yeah,
So
absolutely.
how did you learn that and how did you navigate that?
Mhm. Yeah. So I think first thing is realizing that's a realization that it's not the same game. You
Yeah,
can come in and think, oh, it's healthcare. I have this, the operations piece, not an issue for me. I can do that in my sleep.
yeah,
But like you said, I think the biggest thing is the regulation piece and trying to figure out and navigate what's new, and what's due. What do we need to do to make sure that we're in alignment with the policy or what we're being held to from, the government. I think the biggest thing, like I said, was reaching out to individuals after I went to NAC. I collected so many phone numbers. I networked like there was no end to make sure that I could have those resources at hand. I mean, I reach out to a CEO who is in San Francisco in California. Love her to death. Thank God for her because she has helped me in so many ways. And I'll just, for example, like the SAMs, there are people that will always email you when they realize that you're a CEO and somehow, some way they may find out that you're new. I have no clue. I don't know if it's
they
listed
probably
somewhere.
do.
Yeah, but they will shoot you emails of like, I can do this renewal for you for $3,000. And being a new CEO, you're thinking, oh, okay, it's very important, this regulation. Let's get this done. I was ready to spend that. And she was like, absolutely not. It'll take you less than 5 minutes. Please do that yourself. Because in my gut, my instinct was like, something about this doesn't seem right. Let me ask the question. And so I think to go back to kind of what you're saying, the biggest thing is realizing that I don't have this in the bag in regard to FQHC. This is a new world for me. But I think being dedicated again back to my purpose and making sure that I'm doing the right things for the patients means that I have to do what I'm supposed to do in this seat. So if I'm not familiar with the regulation, if I'm not either researching it and then double checking with someone who has been in the game longer than myself, and then also being willing and open to ask for help and assistance, I think has been the biggest thing that helped me as well. Because, when you're in your role at a large healthcare organization, like going from Norton to Baptist wasn't that big of a deal because, it's a healthcare system. All you have to do is figure out who the people are that you need to ask to do things for you. That's pretty much what
Right.
you need to feel. And then I can do the operations piece by myself in my sleep. But it's the FQHC world of now you're answering to, the government, you're answering to HRSA, you have people that are relying on you. Any decision that you make could potentially either harm a patient or harm your employee, and not being the best decision or, for them. So I think that's the biggest thing that I've had to do is realize that no, you don't have this. You don't, you don't understand all of the regulations, but doing the work to start to have at least an understanding and then knowing when to reach out to someone because you have tapped out.
Yeah.
The biggest thing now is the FTC. And I just had a phone call last week because I'm in another program with NAC that ended with the CEO Institute, but this is kind of like an ad hoc from that. But the biggest thing that I told that individual was, for new CEOs coming into this, there's no book that tells you those little small intricacy details that you need to have this done by this time. Like FTCA is due in June 24th, but no one is telling you. You can get on these calls, but it's a little different.
Right.
So just being willing to do research on your own, be willing to network, be willing to reach out to individuals and know when you have met your capacity, knowing I have no clue. I have researched, I've done everything I can do. I have looked through, let me reach out to some individuals now. So that's kind of how I've navigated. And I'll say even a year in, John, I still don't have a clue. No,
Right.
no.
Well,
I have a clue. Like I have a
I think
clue
you have
now,
more
but
than a
it's yeah,
clue because you're
yeah,
still sitting there.
yeah.
And
I have a clue,
I've
but
heard
it's
good
still,
things about things going on there too. So
yeah. Well, thank
that's
you.
good news, good word in the community. Well, let's
Yeah.
wrap up with the one question.
Yeah.
And you and I share a similar thing. I left. I was a like director level at Yum and left there to go be a C level in a small IT company. Now
Hmm.
at CEO, but I was still C level. And so all those stories you said earlier um, resonate. I mean, going from oh yeah, you're a C level, but you still have to change the paper in the copy machine.
Right.
All that kind of stuff. Um,
Right.
so speak back to your former cohorts in corporate America who are, if you believe the statistics, 75-80% of them are miserable and would love to do something with more meaning and purpose. Just take a moment and speak to them about what it is like to make this transition and why they should certainly consider it.
Why they should consider it. So I will say, if I don't know what I would say. No. So, well, I mean, I guess for me, why they should do that, I would say, even though it's been tough, even though transitioning from, a healthcare organization to an FQHC has definitely been the most challenging of my entire career because I don't think I've ever been challenged
Yeah.
to this extent. I think Norton, I had a lot of responsibility at Baptist. So even with that responsibility compared to this, is not even equal.
Right.
It's two ends of the spectrum. But I will say the fact that I feel like this role has more purpose because of I think I've shared, I'm from this community. But seeing how much this center means to individuals that are in this neighborhood has made it easier for me, because there were days, where I went home to my husband and was like, I could just go back. I could go back to Baptist. It would be a lot easier. Um, but then I remember a conversation that I had with my son in the car. And I think that still resonates with me to this day, is my son, because, your kids listen and they hear you, regardless if you think they're not paying attention, they have the
Right.
little headphones in, they still hear you. And so the conversations that I'm having in my car, or having to deal with this, that, or things being, I'm having to change plans for them. The one thing that I said to my son, because my son said, Mom, do you ever regret your decision of leaving Baptist and going to Shawnee? And I said, had you asked me that probably 30 days in, probably so. But I think now, I can't say that, because I told him, I said, anything that's worth having, you have to work hard for.
Yeah.
And I said, being able to be actually physically seeing the change, because at Baptist, you're behind the scenes as a director of operations. You really don't see it much. And it's kind of
Right.
like, yeah, do you feel like you're changing lives? Yeah, you feel like it. That's what everybody says. But, here, actually getting to visibly see the changes that are occurring, seeing the growth that we're able to go through, and seeing that even though we've gone through those hard times or those bumps, that we still come out, knock on wood, in the end, okay.
Yeah.
I would tell those individuals, go for it if it's truly your passion and it's something that you want to physically see the benefit from. So I think that's the thing that has kept me going throughout the days, is seeing the patients. The patients are coming back, listening to their comments about how they're grateful, actually going out. And that's the one thing too, for me, I think that has been a little different from when I was in corporate America, is I actually can physically go out and have conversations with patients without kind of seeming a little weird, or like, why are you doing that?
Yeah.
But I think for me, that's what I would tell people, is that if that's truly your passion and that's something that you wholeheartedly want to do, and you want to see that change, take that leap. It's going to be tough. I'll tell you, I'm the last
Yeah.
person that will tell you it's easy. It is definitely tough. But when you get the right individuals in the right seats, and you start seeing the benefits from how it's actually changing patients' lives, and how they're grateful of the things that you're doing in the community, or people want to see you thrive in the community, I think that has been the most benefit to me, and has made me stay in the seat and want to be here, because of the patients and seeing how it's changed for them.
Well, that's awesome. And you are certainly inspiration, and congratulate you for completing your first year,
No, thank
and,
you.
and still be sitting there. So if people want to learn more about Shawnee Christian, what's your website?
Yeah, so it's ShawneeChristianHealthcare.com.
All right. And
Yeah.
these folks do great stuff. So thank you again for joining us today. I know listeners are going to be inspired by this. I just appreciate your time and everything you do.
Yeah, well, no, thank you, John. I appreciate that. And yeah, keep an eye out, because we are going through our expansion. So we'll have a brand new center toward the end of this year. So I'm excited about that. So I'll have to invite you to the grand opening on that one.
Awesome. I'll be there.
Sounds good. Thanks, John.
Thank you for listening to today's episode. If you liked it, please share or like it on whatever platform you use. You can find me on social media. On most platforms, I'm John K. Jennings. My first book is also available. Your Baby is Ugly tells you about 10 truths that business owners need to hear, but often won't, and how to overcome them. You can find it on Amazon. Just search for Your Baby is Ugly. And be watching for our next episode, where I'll interview another business owner who will share their stories and insights into what it's like to create a great business.